And now we bring you an update to one of the most extreme COVID survivor cases we've seen in the state of Indiana. A local nurse got so sick with coronavirus, her only option at survival was getting a double lung transplant. I stopped by Carrie Wegg's house for a visit after she finally got back home, as she now is working hard toward being her best. Many walks like this outside are really big steps forward for Carrie Wegg.
I think walking was such a challenge.
When the 48-year-old left her Westfield home last July, she never dreamed that it would be spring of 2021 until she'd be back.
It's totally life-changing. I would have never imagined that I'd be going through something like this.
Carrie and her husband Rodney both tested positive for the coronavirus last summer. But while he recovered, she declined rapidly. Deep in a coma, machines kept her alive for months.
I woke up with tubes in every orifice I had. I had a trach. I was on a ventilator. I couldn't talk because I had the trach. I could only, mouth words. And I knew something had gone terribly wrong because I could see outside my window that the trees were yellow. And I knew it was fall. I knew a long time had passed. And it was a shock.
Rodney is a respiratory therapist, and he knew the outlook was dire.
Logical thing is to just stop all the machines from keeping her alive.
But love defies logic. And Rodney had hope after learning doctors at Northwestern Memorial Hospital performed the nation's first double lung transplant on a COVID patient, and they reviewed and accepted Carrie's case.
It was a roller coaster.
We first talked to the Weggs after her transplant surgery in Chicago.
He told me, COVID killed your lungs.
Yes, it was a dramatic course, but the only option to survive.
It was either get a double lung transplant or it was death.
Carrie's surgery was one of the first, but now Northwestern has performed a total of 17.
Do you want to set a goal for the exit sign?
Nationally, she's one of nearly 50 patients with a double lung transplant after a COVID fight across the country.
Good job, Carrie.
And for each patient, the recovery is very difficult.
The recovery has been pretty rough.
She's learning to breathe with a new pair of lungs.
Yeah, I couldn't have gone this far a couple months ago.
Hi, baby. I miss you.
As Carrie recovered, the couple's teenage boys, Gavin and Gunnar, stayed with their grandmother back here in Indiana while she marked Thanksgiving and Christmas in Chicago. Her goal someday is to be working again as a NICU nurse.
It was central to my being, taking care of the babies and loving on them and helping their families with education and getting them home. It was just such a part of who I was and hopefully who I will be again.
Now she's the primary patient requiring attention. She has 25 medications to help her fight infection and rejection. It's scary, and yes, Carrie has many questions.
What if my lungs fail? What if I need a new transplant? Will I get it? Will my body be able to withstand it? And how will that affect my family? Right now, our whole life has been affected, and it all revolves around my transplant and me not being up to the same level I was before.
But she's here, and she's getting better.
Dr. Barat told us that the lung transplant was hands down the most difficult surgery there is. For me to be lucky enough to get a new set of lungs and have such a talented surgeon doing it I'm really grateful.
She is grateful, and doctors are also telling Carrie to be patient. They expect that her lungs will be fully functioning at 9 months to a year after surgery.